Hello and good morning, everyone. These are questions from July 2022 TOG articles that I've created myself and I think might be quite important for the MRCOG Part 2. The way this presentation is going to work is I will read out the question to you and then the following slide will have the answer on it. So I'll give you a couple of seconds to think about the answer and then we'll move on to the answer slide. I hope you'll find this video useful, and if you do, then please do give this video a thumbs up and subscribe to the channel so you can keep yourself updated with more content. Question number 1 is for sodium levels between 125 and 130 millimoles per litre in labour, what is the management for this? A. No fluid restriction. B. No action needed. C. Fluid restrict to 30 ml per hour. D. Fluid restrict to 80 ml per hour. E. Fluid restrict to 85 ml per hour. And the answer is fluid restrict to 80 ml per hour. Question number 2. Which of the following positive fluid balance increases risk of developing peripartum hyponatraemia? Is it A, over 1000 ml? Is it B, over 500 ml? Is it C, over 2000 ml? Is it D, over 1300 ml? Or is it E, over 1500 ml? And the answer is it's E, over 1500 ml. Number 3, during pregnancy, what happens to the serum creatinine levels in relation to the GFR? A. Serum creatinine increases, GFR decreases. B. Serum creatinine decreases, GFR increases. C. Serum creatinine is unchanged, GFR increases. Serum creatinine is increased, GFR is also increased. E. Serum creatinine is unchanged, GFR is unchanged. And the answer is serum creatinine decreases and GFR increases. Question number 4. What is the average accumulation of fluid in the pregnancy by the third trimester? Is it A, 6 to 8.5 litres, B, 6.5 to 8 litres, C, 4 to 6 litres, D, 2 litres, E, 1 to 3 litres? And the answer is 6.5 to 8 litres. Number 5. What is a reasonably reliable sign of advanced abdominal pregnancy? A. Fainting. B. Displaced cervix. C. Palpable fetal parts. D. Anemia. E. Abdominal pain. And the answer is displaced cervix. 6. What percentage of pregnancies report micturition frequency? A. 50%. B. 61%. C. 41%, D. 68%, or E. 30%. And the answer is C. 41%. Number 7. What is the incidence of UTI in pregnancy? 8%, 5%, 3%, 2%, or 1%? And the answer is 8%. Question number 8. What is the incidence of pyelonephritis in the pregnancy? Is it 8%? Is it B 5%? Is it C 3%? Is it D 2%? Or is it E 1%? And the answer is D 2%. Question number 9. What is the first line investigation of diagnosis of UTI? A. Ultrasound. B. Urine dipstick. C. Blood test. D. Symptoms. E. Midstream urine sample sent for culture and sensitivity. And the answer is B. Urine dipstick. 10th question, we're halfway through. What is the dose of cefalexin that is recommended by NICE as antibiotic prophylaxis in recurrent UTIs? Is it 100 milligrams, 1000 milligrams once a night, 125 milligrams once a night, 500 milligrams once a night, 125 milligrams twice a day, 250 milligrams once in the night? And the answer is 125 milligrams once in the night. Which of the following is a risk factor for recurrent UTI? Is it A, first UTI less than 20 years of age, B, first UTI less than 15 years of age, C, first UTI less than 25 years of age, D, first UTI less than 30 years of age, or E, first UTI less than 16 years of age? And the answer is B, first UTI less than 15 years of age. Question number 12. What does VESSI in context of urinary retention stand for? Is it A, vocalize, empathy, sensation, stream, incontinence? Is it B, volume, empty, sensation, stream, incontinence? Is it C, volume, empathy, sensation, stream, incontinence? Is it D, volume, empathy, sensation, stress, incontinence? E, volume, empty, sensation, stress, incontinence? And the answer is volume, empty, sensation, stream, incontinence. Question number 13. What is the percentage of postpartum urinary retention? 20.4 to 50%, 15%, 20%, 14.6 to 24.1%, or is it E, 9 to 13%? And the answer is 14.6 to 24.1%. Question number 14. What is the percentage of women with a retroverted uterus? A, 15%, B, 20%, C, 40%, D, 10%, or E, 50%? And the answer is B, 20%. Question number 15. What is the percentage increase in blood flow to the kidneys in the pregnancy? Is it 45 to 55%? Is it 40 to 50%? Is it 50 to 60%? Is it 20 to 30%? Or is it 10 to 20%? And the answer is 50 to 60%. Question number 16. What is the gestation at which feticide is recommended for termination of pregnancy? A, 30 weeks, B, 28 weeks, C, 21 plus 6 weeks, D, 23 plus 6 weeks, or E, 24 weeks? And the answer is C, 21 plus 6 weeks. Question number 17. What is the prevalence of stress urinary incontinence during the pregnancy? Is it A, 20%, B, 19 to 75%, C, 25%, D, 50%, or E, 100%? And the answer is 19 to 75%. Question number 18. Which muscle of the levator ani complex is most prone to damage during delivery of the head? Is it pubococcygeus? Is it puborectalis? Is it puboisthmus, transverse perineal muscle, or deep perineal muscles? And the answer is puborectalis. Number 19, what is the percentage of patients who have residual sphincter defect with previous sphincter injury detected on follow-up ultrasound? 15%, 20%, 40%, 60%, or 80%? And the answer is 40%. Last question, what is the prevalence of bladder pain syndrome in women? 7%, 3%, 2 to 6%, 2 to 4%, or 2%? And the answer is 2 to 6%. Well, that's it for the questions from July 2022 talks. I hope you found these questions useful and also a good way to trigger information that you probably perhaps haven't looked at in depth or have or the numbers have slipped from your memory. So it's worth going back and just re-reviewing these questions and your notes so you're able to learn all these important numbers. Now, I do have the videos up for the TOG July 2022 part 1 and part 2, where I've covered all the articles that you will need to know from these TOGs and a summarized version of them, and I do talk through it so it's not as boring as you may find reading it from the journal article itself. If you did find this video useful, then please don't forget to give it a thumbs up and also subscribe to the channel and leave a comment if you found this particular presentation style useful and if you would like to see more videos of this sort of content. Good luck revising.